everybody, this is You Know You Are Beautiful with Chronicles of a Breast Cancer Patient. I'm just sitting in my car outside my son's school parking lot to pick up him from school today. I'm in my 4th week of chemo treatment, but I'm doing okay. I'm losing a little bit of my hair from the edges and the middle. So I keep the band around my edges and the middle part because I'm losing hair in the middle plus my edges. But I can still probably, pop on a fake ponytail and what have you and get to moving. But today I want to talk about how to tell your child, or if you tell your child that you have breast cancer. The physicians and social worker and different counseling they give you when you find out you have breast cancer, there's a lot of support system within your institution. I know my institution had a lot of support system. They assigned me a social worker, they give you psychologists, and even help from the healthcare professionals. It helped me out a lot. I'm still, into videotaping, and when I tape myself, I look at myself, and I probably have to learn how to look in the camera part so you all can see my eyes more. But, I'm trying to be real. I'm doing what feels comfortable, and I'm pretty sure I get comfortable as time go on. But how do I tell my child? At the beginning, I didn't want to tell my child. At the beginning of everything, I didn't want to traumatize him. I didn't want to make him sad. I had a mastectomy of the left breast and tissue expanding that I decided on to put in an implant. And I knew I was going to tell him at the beginning I was having surgery. That was no problem because I did not want to go under the knife without my child knowing I was going under the knife, because things can happen. You can have complications. Mommy, why are you sore? So I was going to explain that I was having surgery, but my problem was of what I wanted to tell him was the C word. At the beginning, I could never call it cancer myself, and it's like, how do I drop the C word on him? How do I tell a 12-year-old, but he was 11 at the time, but he was turning 12 within a couple of weeks, that I have breast cancer? Because we do have certain family members that did pass away with cancer, different types of cancer, or currently in cancer. I did not want to scare him or make him feel sad or make him feel like mom is dying. That's why I had a problem with telling him that I have cancer. So it took a lot of soul searching and deciding, and help through the institution and physicians and social worker, that I came to the realization I had to tell him. And these are my reasons why. You all may not agree with me. I support whatever any parent decide to do, but this is why I made the decision that I made. First of all, I couldn't go under the knife without my child knowing, because things can happen. Second, why I set him down and told him I had cancer, breast cancer, is because I realized through social worker, my physicians, nurses, that kids are not stupid. He did start noticing I was going to doctor visits more, or I was home more. My parents was going to the doctor with me, and you think kids don't notice your habits and things changing. They do. So I didn't want him to find out later or personally have resentment. I don't think he would have had resentment, but if something would have happened, I didn't want him to feel like I didn't trust him or I did not love him enough to not to tell him. And you all may think that's absurd, but I guess I don't know how to explain it. Because if something did happen, or if I was at a stage where it was necessary to tell him, I did not want to tell him at the last minute. So it wasn't a forced conversation, but there was an opportunity to arise where I felt comfortable. We were at home. We were cooking breakfast. And I just said, I have something that I want to talk to you about. And I said to him, I was just diagnosed with breast cancer. He didn't believe me at first. He took it well. I had to show him proof, though, because he didn't believe me. I showed him my paperwork where they gave me a book to read about breast cancer, and he said, "Oh, Mommy, you're serious." I said, "Yes, son. Why would I joke around with this?" So, but you'll be okay. God got this, because we do have a Christian background. So he took it well. Excuse me again. He took it well. So he took it well. I was blessed for him to take it well. And I gave him as little information as possible. They caught it early, which is true. And I had the option to get it out. They're going to remove it. And from there, they will decide for treatment. But I let him know and ensured him they caught it early. And so that was a good thing. And this is what's going to happen. They're going to take it out. I am going to be sure. I didn't go into what cancer is or what cancer can cause or any of that. I kept it sweet, short, and simple. The question he did ask, "Mommy, are you going to lose your hair?" I said, "I do not know. I may not need chemo. So they will not know my treatment until they remove it. But yes, if I have chemotherapy, it's a possibility that you may lose your hair because of the chemicals that are in chemotherapy can cause your hair to be lost. Not everybody lose their hair. I did tell him that, but I believe a majority does. But yes, there's a possibility you would lose your hair. But I do not know if I need that yet. We'll deal with that when that comes." He's fine. I didn't give him any more or any less information than what he needed I felt was appropriate for a 12-year-old. But I did allow him to come to me with questions. Before I answered the question, I answered them the best of my ability. But because I believe I kept the answer short and sweet, he was okay. So I went with telling my son. I told him that I did have cancer and I was having surgery. Now, I will say I did not tell him immediately when I found out. I did not tell my son until school year was about to end, because of the fact I needed him to finish the school year on the positive note. I told him about 2 weeks before school year ended, because on his last week of school was when surgery was going to be. So I didn't want to tell him 2 days before surgery, a week before surgery, because I did not know how he was going to react. But I knew I wanted to tell him about it before surgery. So I told him 2 weeks before surgery, even though I knew a couple of months beforehand, because I wanted him to finish the school year on a positive note. I did not want his school grades to drop or anything. But if this is the middle of the school year for some people and telling their kids, where fortunately I believe it worked out where it was towards the end of the school year, it worked out for me. But for those parents where it's beginning of the school year, September, I did inform his teachers, his counselor, and his principal, because of the fact I didn't know how he would react with this information. But they said he did well. Because he goes to a Christian school, they are able to put in prayer requests or any kind of thing that can help him deal with it, because of the type of environment that my child do go into school at. And I'm pretty sure in public schools they would have, sent the prayer anyway, because I went to a public school. But I think the environment in which he's in did help him. And plus the environment of informing his teachers and also informing the principal helped him out a lot. and I had people aware of what he was dealing with. So goodbye. Whatever you guys decide to do, it depends on your family. I'm not telling you what to do, but if you all had issues with that with me, it took me a while to think about it, and that's the conclusion I came with. So I told my child I did not want to leave him out in the dark, and now with the process of moving forward, the things we have to deal with now with chemo, it makes it easier because he knows what's going on. Thank you, and stay tuned for my next video.